You want to support Roland Martin Unfiltered? Be sure to join our Bring the Funk fan club. Every dollar that you give to us supports our daily digital show. There's only one daily digital show out here that keeps it black and keep it real as Roland Martin Unfiltered. Support the Roland Martin Unfiltered daily digital show by going to RolandMartinUnfiltered.com. You can make this possible. How we also protect workers. Well, Virginia Congressman Bobby Scott, Congresswoman Alma Adams, and Donna Shalala introduced a bill to protect U.S. workers from COVID-19. It's called the COVID-19 Every Worker Protection Act. It will require the Occupational Safety Health Administration to give an emergency temporary standard that puts a legal obligation in place to ensure that all workplaces implement an infectious disease exposure control plan to keep workers safe during this pandemic. Joining us right now is Congressman Bobby Scott. Congressman, glad to have you back on Roland Martin Unfiltered.
Good to be with you, Roland. How are you?
Doing great. First and foremost, unfortunately, when it comes to these type of stories here, you have the federal government who wants to rush supporting these states in terms of this White House to reopen. But frankly, they haven't put things in place to protect essential workers.
Well, that's the bill that we've introduced simply requires OSHA to establish enforceable standards to protect the workers. There has been a standard floating around OSHA trying to get promulgated for the last 10 years to protect workers from infectious diseases. They haven't moved on it. And now we're trying to get them to move on it. And we've been writing them since early in this problem that workers need protection. After you've got workers in senior citizen homes, grocery stores, prisons, meatpacking plants. When you have an outbreak, the businesses need specific things they need to do that are enforceable by OSHA. That's what they're there for,
right,
to make sure that the workers are protected. They have issued, just in meatpacking plants and healthcare, unenforceable guidelines. We need to make sure that these standards are enforceable, working with the CDC. You've got businesses trying to make up stuff. Well, maybe if we did this, it would help. No, OSHA is there with their expertise, working with the CDC to tell people specifically what needs to be done to protect the workers. They're not doing it. And so you've had outbreaks in senior citizens' homes. You've got outbreaks in prisons, and nothing is being done but an occasional unenforceable guideline. And so what we've done is introduce legislation requiring OSHA to come up with some enforceable standards on an emergency basis to make sure workers are protected.
And when we talk about protecting these workers, first of all, it's not just when it comes to even cleaning workplace. We're also talking about when you're having people who are come in. You know, what is going to be the process there? Who's also paying for that? Are workers going to have their own mask? Are they going to have their own gloves? Are workers going to bring in their own cleaning equipment? We already see where Amazon workers have tried to protest. They've been fired as a result of this. These are people who are saying, yo, we're trying to protect our lives and our families' lives.
Well, one of the provisions of the bill is what's called anti-retaliation. If you have complained about the unfair and unsafe workplace, you should not be retaliated against. But this would just set standards. I mean, you could have in a grocery store things like requiring customers to have masks, to have a plexiglass shield between the customer and the cashier at checkout. You could have require the carts to be wiped down so often. There are a lot of little things you can do, and you don't need me making this up. You need OSHA going through and telling every grocery store in the country exactly what they need, and then move to the next. What do you need in prisons? And then go to what do you need in meatpacking plants? And so you don't have people just making stuff up. They need to use their expertise to protect the workers. In prisons, if they protected the prison guards, they would necessarily have to protect the prisons. And it's an outrage what's going on in the country today with prisoners becoming infected. But OSHA needs an enforceable standard to make sure that workers are protected. That's what OSHA is there for. And it can't be just voluntary guidelines. They're nice, but we need enforceable standards because too many workers are being infected by the virus unnecessarily. If the workplace was safer, we wouldn't have nearly the number of cases that we have.
Well, and of course, if you had a White House that actually cared about workers as opposed to companies, you would have them leading the charge, and this would have been something they thought about long before they urged states to reopen.
One of the problems we've got is that if you listen carefully to the experts, there's no intelligent way to open up the economy without massive testing. Because otherwise, if you wait for a case to occur, and this is what has happened in meatpacking plants, you have someone who has symptoms, you test them, they're positive. Well, by the time they've got symptoms, they've been spreading the virus all over the plant for the last 2 weeks. The people they've been spreading it to have been spreading it for the last 2 weeks, and it's all over the plant. By the time someone is symptomatic, they've been spreading it all over the place, and the only way to contain this is significant testing, so you can find out where it is before the outbreak gets out of hand. And the only way you can do that is testing, what they call contact tracing, and then isolating those that are positive. That way you can get some reasonable, you can get a reasonable hold on it. If you have students that come in, you need to test people in schools frequently, because if someone has a virus, you need to shut the school down. If you don't know who has it, you end up having to shut all the schools down. The only tool the governors have without testing has been just to shut everything down. If we'd had testing, we could have, in areas where the outbreak isn't even there, there's no reason to shut down. But you don't know what those areas are without testing. And there's never been, in this whole episode, you said 71,000.
71,000 dead.
All from the beginning. There's been no urgency from the time the president was at the Centers for Disease Control in his campaign baseball hat, bragging about how good the tests were, all the way to the day they're saying, we've got plenty of tests, and you ask people on the ground, they will tell you that there are nowhere near enough tests being performed. We need about 10 times more than they're doing. And you just can't test somebody once if you want to have some sort of clarity. If you're in a meatpacking plant, if you test everybody one day, then tomorrow afternoon somebody may be infected and you think you're safe. You have to continually, on a routine basis, test people, and you cannot open up the government and expose everybody to another total outbreak without testing. There's no plan that works without testing, and that's one of the problems we have now. There is no sense of urgency, even from the beginning, and the workers, and so the workers aren't being protected. We need health care protections. I've introduced legislation on that. If you lose your job, you lose your health care. There's a provision where you can keep your health care if you pay your premiums. That could be $500 to $1,500. And if you just lost your job, you don't have $500 to $1,500 for a premium. This would allow you to pay those premiums under what's called COBRA, so that you can keep your insurance. Otherwise, you have to go into the marketplace, get a cheap policy on Obamacare or Medicaid. So we're going to be subsidized in it anyway. So why make somebody start off a new policy, start off a new deductible, get new providers, and then in a couple of months get the job back? You got to say goodbye to those providers. You come back, you got to start your deductible all over again? Sign up with your old providers? I mean, why put people through that? We need to let people keep their insurance. We need to have those states that haven't expanded Medicaid, expand Medicaid. We need people to be able to sign up for health care if they can. There are a lot of things we can be doing in health care, but there's just no sense of urgency. But the fact that we're not protecting the workers under OSHA is just tragic.
All right, Congressman Bobby Scott, we certainly appreciate it, sir. Thank you so very much.
Thank you, Roland. I like your sweatshirt.
Of course. All right, my fellow Alpha brother, thanks so much.
Every single night, we've got some of the top black experts. You're not going to see them on cable news or broadcast news because you swear black people aren't experts when it comes to this health crisis. That's why we have this show and why we do what we do every day on Roland Martin Unfiltered.
Joining us right now is retired General Russell HONORE, the nation's first black Surgeon General.
Dr. Joycelyn Eldridge.
John Hope Bryant, he's the founder of Operation Hope.
Senator Kamala Harris of California. Dr. Sadrina Calder, retired General Lloyd Austin. Congresswoman Karen Bass, Commissioner Omari Hardick. Bureau President in Brooklyn, Eric Adams. Dr. Joseph Graves. America's Wealth Coach, Deborah Owens. Dr. Corey Abear, Patel Salt. Howard University student. Pastor Jamal Bryant, Dr. Christy McDowell, Benja Ajilore, senior economist at the Center for American Progress. Gilda Daniels, again, author of the book, The Crisis of Voter Suppression in America. 4 stars, General Kip Ward. Dr. Oliver Brooks is president of the National Medical Association, president of the American Medical Association. Dr. Patrice Harris. Joby Benjamin.
Dr. Alexia Gaffney, infectious disease specialist. Dr. Georges Benjamin, executive director of the American Public Health Association.
Malcolm Nance, family medicine physician, Dr. Jen Caudle. Dr. Tashaka Cunningham, a molecular biologist, Kat Stafford. She's a national race and ethnicity reporter for the Associated Press. Dr. Wayne A.I. Frederick, who is the president of Howard University. Congresswoman Yvette Clarke from the state of New York.
William Spriggs,
AFL-CIO economist. Andrea James, executive director of the National Council for Incarcerated and Formerly Incarcerated Women and Girls. All right, let's go to Capitol Hill. Congressman Gregory Meeks, Congresswoman Eddie Bernice Johnson of Texas, Congresswoman Barbara Lee, Minnesota Senator Amy Klobuchar, mental health clinician Jamie Singletary, Prince George's County State's Attorney Aisha Brayboy, as well as Dylan HAYRE, ACLU Justice Division strategist. Dr. Cindy Duke, she's a virologist. Principal Steve Perry of Capitol Prep. Health and wellness specialist Dr. Yolandra Hancock. Desmond Meade, president of the Florida Rights Restoration Coalition. Cliff Albright, who is the co-founder of Black Voters Matter. Michael Harriet with The Root. The Mina McWhorter, founder of Love by the Hand. Dr. Julianne Malvo, economist, president, Emerita Bennett College. Coroner Michael Fowler is the mayor of Atlanta. Keisha Lance Bottoms, mental health therapist Suzette Clark.
Justin Giboney, attorney and political strategist, and Bishop Vincent Matthews Jr.
Dr. Suzette McKinney, CEO and executive director of the Illinois Medical District. Dr. Leon McDougall, president-elect of the National Medical Association. Jana Bailey, mayor of Moss Point, Mississippi. Mario King.
We're going to keep driving this thing to make sure our people are fully aware, safe, protected from coronavirus. You're getting the top medical experts, the top business experts, top political experts, top religious experts, because that's why we do what we do. Unapologetically and unfiltered. Ain't nobody else in the black media space doing what we do. Watch Roland Martin Unfiltered daily at 6 p.m. Eastern on YouTube, Facebook, or Periscope, or go to RolandMartinUnfiltered.com. Support the Roland Martin Unfiltered Daily Digital Show by going to RolandMartinUnfiltered.com. Our goal is to get 20,000 of our fans contributing $50 each for the whole year. You can make this possible. RolandMartinUnfiltered.com.